Welcome to Real Talk in Medicine. This is a podcast production of UT Physicians. My name is Shelley Vanker, and joining us today is Dr. Amy Garcia, a licensed psychologist here at UT Physicians. You also specialize in autism spectrum disorder and assessment of both pediatrics and adults. Thank you so much for joining us, Dr. Garcia.
Thank you for having me.
Yeah, we are going to get into autism, but I want to start with what inspired you to pursue this particular career?
Sure. So my personal experience with autism really is what led me to this professional work that I do now for individuals on the autism spectrum and their families. So my older sister was diagnosed with autism in the mid-90s. It used to be called pervasive developmental disorder, not otherwise specified. Now everything is just under the autism umbrella. And so I really kind of just grew up with her and, helped her with her social skills and expanding her diet. And I always just knew what autism was, and I didn't think it was a bad thing. And, I got into grad school and pursued a PhD in psychology and started working more professionally with children with autism and adults too. That really kind of solidified my passion for this work that I do.
Yeah, and you also worked with the school district here locally in Greater Houston, which gives you a great background as well when we're speaking about pediatrics. So let's get into autism. Let's start with what is autism and how is it diagnosed?
Sure. So autism is a neurodevelopmental difference that is marked by two major areas here. So these are the things that we're looking at. So autism impacts the way that you communicate and interact with people and process the world around you. So under communication interaction, we're looking at three major areas here. So we're looking at something called deficits in social emotional reciprocity. So what is it like to have a back and forth interaction with you? For young children, I'm playing with them, playing pretend, seeing if they're able to build upon my play themes, or if they would rather continue playing with what they're doing, or if they're overly directive in play. For children, older adolescents, and adults, I'm trying to see what is it like to have a back and forth conversation with you. Are we asking each other questions about what the other person is saying? Are we building upon what we're saying? Or are we just kind of talking at each other? Then we look at differences in nonverbal communication. So eye contact is the big thing that people think about when they think about nonverbal communication, but it's not just eye contact, it's using eye contact, gestures, and words together. A lot of people think about, are they able to make eye contact? Are they initiating and maintaining eye contact? Or if they do, is it really uncomfortable and they're thinking a lot about it? Then lastly, we look at differences in initiating, developing, and maintaining relationships. So this is from being interested or not interested in other people as social partners, not having friends, not understanding that there's supposed to be a reciprocal nature of friendships. The other area is something called restricted and repetitive patterns of behaviors and interests, but the way I kind of translate that is it just impacts the way that you process the world around you. So there are four major things that we're looking at, and you really only need two in order to have the diagnosis of autism spectrum disorder. So the first thing is sensory differences, so having sensitivities to loud sounds, bright lights, clothing textures, food textures, right, like sensory experiences. But on the flip side, there's sensory seeking behaviors. So for young kids with autism, you may see them looking at things really closely, out of the sides of their eyes, things like that. We also have repetitive motor movements, so you might think of whole body rocking or flapping your hands together, but for a lot of people I see, it can be even more subtle, repetitive, hand and finger movements.
Right exactly,
okay. Yeah, or slight rocking or pacing, things like that. We also see something called insistence on sameness. So this can look like difficulties with changes, unexpected changes, difficulties with transitions from one thing to another, or big life transitions, things like that. And lastly, we see areas of intense interest. So I always say it's not a bad thing to have interest. It's not a bad thing to like your interests. But for individuals on the autism spectrum, these interests can be really intense to the exclusion of other activities like sleep, work, school, social obligations. So that's kind of all of the symptoms of autism that we're looking for. They do need to be present in the developmental period, so early childhood, and have some level of impairment in functioning.
Okay, that was a great explanation. Let's go to common misconceptions. Is there something that causes autism?
Good question. So we know that there's no one cause of autism. There's a lot of research into this, right? People want to know if I diagnose a child with autism, that's usually one of the very first questions that parents ask me is like, did I do anything that caused this? And I always tell parents there's nothing that you did or didn't do that caused your child to have autism, right? Because we know there's a genetic component. So if a family member has autism, you may be at an elevated likelihood of having autism as well, right? But we know there are also environmental factors, again, that are associated with an increased likelihood of having autism spectrum disorder. So things like preterm birth, advanced parental age, birth injury, things like that. But we know that there's no one cause of autism.
And then another common question that I feel like parents often have is that will they have this level of autism forever?
Good question. So with levels, we have 3 different levels, and it's all about how much support do they need to communicate and interact with people and process the world around them. So level 1 is requiring support, level 2 is requiring substantial support, and level 3 is requiring very substantial support. All these levels are really for treatment purposes. The levels are supposed to change as we get therapies and supports on board. So, it's a case-by-case basis. We always say when you've met one child with autism or one person with autism, you've only met one person with autism. But in general, the levels of autism do change as there's response to treatment and support and intervention and things like that.
Okay. When it comes to speaking about students or children with autism or on the autism spectrum disorder, what's the best language to use? What is a friendly way to address it?
Yeah, great question. And so I always preface this explanation of try not to get bogged down with how you talk about autism, because then sometimes people can then become like afraid of talking about it, and that kind of defeats the whole purpose of like a thing like this podcast, right? So in like mental health, we are usually trained with person-first language. So saying person with autism or child with autism, because the idea is, right, they're a person first. But autism is kind of a unique disability in that it's really a part of your brain. So you can't change your brain. You can't take it off and on, right? So a lot of autistic self-advocates really champion for this idea of identity first language. So saying autistic person or autistic child, which that can make people uncomfortable at first, right? They're like, ooh, is that a bad word? It's not. It's just the way that their brain is developed. They're autistic. A more neutral way of talking about autism is like they're on the autism spectrum, but really try to avoid saying things like suffers from autism because that, communicates this idea that autism is a really bad thing that people suffer from, right? When there are lots and lots of people with autism where that's a key part of their identity and their brain, and they're very proud of it.
So what does an evaluation look like?
Yeah, great question. So, for an autism evaluation, we're gathering developmental history. So I always tell people we're going all the way back. I have to ask about your mom's pregnancy with you, right? Because we know that there are some like birth complications and pregnancy complications that are associated with an elevated likelihood of having autism. So that's why I ask those things. So we ask about developmental history. When did they start to walk? When did they start to talk? Things like that. What did they like to play with when they were young? Because we're getting at, what were the things that they're really fixated on, or did they do anything different with their toys, like lining them up or arranging them in certain ways. We also ask about school, what grade you're in, how you're doing in school, do they already receive any accommodations. We ask about medical history, so anything in your medical record I should know about, how's your sleep, how's your eating, any major picky eating, things like that. We also ask about emotions, behaviors. It's kind of just a broad range of, okay, what was life like for you as, a young child, and what is life like for you now? And then there's kind of this direct testing component. So for children, adolescents, I like to get an idea of where their intellectual functioning is. So we're looking at their verbal skills, their nonverbal skills, their abilities related to working memory. So your ability to hold something in the front part of your brain and manipulate it to give me a new answer to a new question. And then something called processing speed, so your ability to do simple tasks quickly and efficiently. And then we do direct testing, specifically looking at the question of autism. So that's when I'm doing back and forth play or back and forth conversation for the older children, asking them their understanding of emotions, friendships, relationships, things like that. On top of that, we also have non-direct measures, so questionnaires for the parents to fill out. I always say, I have you in my office for a couple hours. It's super helpful, but these questionnaires are really helpful because they give me a glimpse of what is life like for you outside of these doors. And so that's what an evaluation looks like. You should get a written report of all of the results and recommendations, and it's always best practice for a provider to also give you verbal feedback. So going over the report with you, kind of treatment planning, what are next steps for your child or adolescent on the autism spectrum.
And is all of this done in one setting?
Good question. So I do it in 2 separate appointments just because I like to do what's called the intake interview, where I'm gathering all the developmental history and kind of just sit with it for a week or 2 and then have them come back for the direct testing. Other providers do it all in one day. It's just a preference thing. Neither way is good nor bad.
And is there an optimal time, an optimal age frame by which you should try to seek out an assessment?
Good question. So we know that early intervention is best. So as soon as you think that there's something is wrong, you should ask your pediatrician and don't let them tell you to wait and see. So we can reliably diagnose autism by age 2, actually. So I've seen some 2-year-olds. But, for whatever reason, right, I see a lot of the individuals who are really bright and verbally able, so they may have gone longer than that, maybe childhood, adolescence, until they've identified that they may have autism, and that's okay too. I try not to, parents shouldn't feel bad about when they bring their child in, but if you notice that there's something a little bit different about your child, to ask your pediatrician about it and see if an autism evaluation is a good recommendation.
When you say that early intervention is key, what are those intervention methods?
Yeah, so for young children with autism, we recommend speech therapy, so, to work on developing speech, because a lot of the littles that we see with autism generally have a speech delay. Then occupational therapy, so that's helpful for like motor skills or figuring out ways to handle sensory sensitivities. So creating a sensory diet, which can look like having earplugs available. Sometimes individuals on the autism spectrum need a lot more movement, so having like a trampoline at home, things like that, like sensory seeking things. But the gold standard therapy for young children with autism is called ABA therapy, or applied behavior analysis. So this is using behavioral principles to increase desired behavior. So we use kind of these principles all throughout life. So, right, this idea of positive reinforcement. So we work our jobs because we get the reinforcement of payment, right? So for ABA therapy, right, it's increasing speech and being reinforced for that in whatever methods are, the child has, increased desires or wants or needs. And then for older children and adolescents, we see speech therapy can be helpful, especially for like the social use of language. So you'll literally sit with them and have a back and forth conversation with them. Occupational therapy can still be helpful too, right, to increase core strength, things like that. But really, as you get more into like school age and adolescence, we have social skills groups. So they're structured social groups, usually with like a speech therapist or any other like mental health provider, where they'll go out and do things. So there's one group called social motion skills, where they'll have classes for social skills, but they'll also take them out and like go out to eat so they can practice ordering at a restaurant, things like that.
Okay, great. So let's jump into transitions, life transitions, school transitions. We're in a back to school season. One of the core components you mentioned was difficulty with change and transitions. So talk to us, give us some tips or strategies as we head back into a new school year. What can parents do?
Sure. So the core of it, right, to help individuals on the autism spectrum kind of prepare for big transitions is to plan ahead and be open and honest with your child. So, for example, figure out their schedule if you're able to, figure out who their teacher is, let them go to the school, walk their schedule, even go drive to the school, do that morning routine even before the school year starts. It's all about planning ahead because I found with a lot of the adults I see, yes, they have difficulties with changes, but it can be helpful for them to know about those changes in advance because it can kind of help them like mentally prepare for it. So as parents, right, we can do those things for our children.
That was great. And especially if they're switching up, like from one campus to another, a major school transition, going from elementary school to middle school or middle school to high school or even high school and beyond. Is there any key advice for switching campuses and entering a new school building with a new school environment?
Sure. Yeah. So I'll kind of go one by one and break it down because each area and, life stage, of course, will have different suggestions. So from elementary to middle school, right, this is a big transition. In middle school, you may have more teachers, right? Now you don't just have like one homeroom. You may have multiple teachers. You may have more options for like extracurricular activities throughout the day, things like that. So it's really, letting the child go to each classroom, meeting their teachers, things like that. From middle school to high school, even more classes, more opportunities for extracurriculars. So really coping ahead, right? So letting them walk the campus, meeting their teachers. If they know who their, classmates are going to be, letting them, meet them ahead of time too. And high school to college is a huge transition for any child, right? And so, for our young adults on the autism spectrum, kind of having that major life transition, it probably will look different than our non-autistic young adults. So from high school to college, they may lose a lot of the services that they had as a child. It's something called the services cliff. We know there are lots of really great resources for children on the autism spectrum, but once they hit 18, a lot of those kind of just go away. So for high school to college, right, I always tell parents, they don't have to do the full course load. They don't have to do the full 5 classes per semester, right? Maybe even just doing 1, 2, or 3, starting out at a community college, right? We have lots of really great community college resources in the Houston area, starting at one of those, having them live at home. We often think about when we start college, I get to live on campus and go to a dorm, right? But that's a huge change for anyone. But for our young adults on the autism spectrum, that can be a major, major change that leads to a lot of disruption, like emotional dysregulation, right? They may have average intelligence, be smart enough to do these classes, but right, if you have, difficulties maintaining a schedule, you may not do as well in classes. So that's why I always say start out, 1 to 3, find out what they're passionate about, maybe have them stay at home, again, just to avoid as many changes as possible. But I always do think college is possible for, children and young adults on the autism spectrum.
That's great to hear. It sounds like a slow ramp up into that huge change is the best practice.
Yes.
Okay, very good. And then how can we help, as through these transitions, help students with autism to not only exist, but to thrive, right? What can we do at home or in the school system to help them really find their place and to grow into who they are?
Yeah, so I always encourage parents to be interested in your child's interests. Again, a lot of this advice can obviously apply to parents of children without autism, but it's really important for children with autism. I found that some of the young adults and adults I've seen, as they've reflected back on their childhood, their interests are very important to them, and if people aren't interested in them or find them boring, it's almost like an attack on their character. So showing genuine interest in their interests, allowing that interest to be a part of your school projects as much as possible, finding extracurricular activities, karate is a good one, but also structured like social activities like a baseball team or a soccer team where they have exposure to non-autistic, typically developing peers. So I think really honing in on their interests can help them, thrive.
Yeah. And why is it important that they have the exposure to social groups and teams like that?
Great question. So when we think about social skills and social rules and social norms, right, for neurotypical people, I always say it's like this big book of them that are just kind of ingrained in neurotypical people. But for individuals on the autism spectrum, they literally have to learn this giant book. So I've had adults say I've read books on how to figure out how to socialize with people. I've had to watch TV shows and movies in order to watch characters and see how they're interacting with others and try to apply that. It's this idea of camouflaging or masking social and behavioral differences, which is it's a popular term in social media right now. So camouflaging is this idea of engaging in behaviors to appear more neurotypical. So feigning eye contact, sitting on your hands so you don't engage in repetitive motor movements, things like that. So I'm not saying to engage in these social interactions to learn how to camouflage, but having exposure to non-autistic peers where they're also accepting of autistic people, can help them, learn different ways to socialize. So when we talk about when I've talked about, autistic social skills, I'm not saying these are bad or these are making them a bad person. There's a neurodivergent or autistic way of communicating and a neurotypical way of communicating.
Okay. So practice, like engaging, that's why it's important to join these programs and teams. Okay.
And we know that children with autism, generally want to have friendships. But autistic friendships look a little bit different because there's this added layer of social anxiety, like, am I being perceived, well, do they like me? Am I making enough effort? Things like that.
Okay, very good. And let's talk about if you are a parent and you believe you may need an assessment for your child, what are the first steps, and talk to us about what the wait list can look like, because I've heard it could be 6 months or longer.
Sure. Yeah. So definitely reach out to the pediatrician first and say, hey, I'm wondering if my child may have autism. Do you have any referrals? And so I get a lot of referrals from UTP pediatricians and psychiatrists as well. So there's, I would go through the pediatrician for referrals. At UT, there's my office here at the Department of Psychiatry. We also have the Danielle Duncan Clinic in the Department of Pediatrics. They do autism evaluations as well for children. And lastly, we have another clinic within this department led by Dr. Deborah Pearson called the Developmental Neuropsychology Clinic, and they also conduct autism evaluations. So there are resources for UT Health patients. So that would be my first recommendation. So that would be to get a clinical medical diagnosis of autism. If your child is in their local school district, I would also recommend to reach out to the special education department of your local school district where you're zoned to and request for an evaluation for autism for special education services. Once the consents are signed, the school then has 45 school days to complete what's called a full and individual evaluation, or an FIE, to determine whether your student demonstrates educational need as a student with autism. So it's a little bit different. You're not getting a clinical diagnosis, but there are services in schools that children and adolescents with autism can benefit from.
It's another route you can take to get the assessment at probably a faster rate.
Correct.
Okay. So it's 45 days within a school district, a public school district, but do you know what your current wait list is?
Correct. Yeah. So mine is about 6 months to a year.
Okay. Yeah. And it's just because it's in such high demand?
Mm-hmm. Yeah. And I also see lifespans. So I not only see children, but I also see adults.
Yeah. Alrighty, you're busy. Okay, so for parents who don't have a child with autism, but they're sending their child back into the school year, and they know of classmates, or they know they're going to encounter other students and peers who are neurodivergent, what's your advice to share with those children at home?
So my advice is it's all about autism acceptance. So initially, we're just trying to be aware of autism, but now we are aware of autism, but it's really being accepting of autism. So we should teach our children to be accepting of individuals who are different from us, and that applies to all sorts of differences, right? But for this idea of autism acceptance, the good thing is parents don't have to make it up. There are lots of resources online that are available for parents to kind of review and use with their children. So Sesame Street has a puppet named Julia who is autistic, and there are lots of really great episodes, including her. And then for our older children and adolescents, there are other types of media that include neurodivergent folks, right? So we always think about live on the spectrum. So it's really, again, just teaching our children to be accepting of others, because we truly need all types of brains to make this world go round.
I love that quote. That's such a beautiful quote. Thank you for sharing that with us. Thank you for sharing your expertise and your time. It was so great to have you here. And thank you for tuning in to Real Talk in Medicine, a podcast production of UT Physicians.